My name's Juli Spendley, and in September 2009 I was diagnosed with neuroendocrine tumour in the bronchus. Unfortunately, because I'd had lots of problems in getting diagnosed for about a year or two beforehand with various different symptoms, it had spread to my liver and to my bones. I was treated locally to start with. They wanted to put me on some chemotherapy, but they hadn't actually had any patients with neuroendocrine cancer, so I was rather scared. And they didn't give me a very good prognosis. They said it would probably be only about 6 to 12 months that I would be lucky to survive, and that's if the chemotherapy worked at all. So I was very, very frightened, very alone. I had no one to turn to, and I asked if there were any experts out there. But locally, they seemed to be a bit reluctant, to do that. So eventually, I did do a self-referral to the Royal Free. I literally Googled, neuroendocrine cancer to find out, anything about it. And as a nurse, I actually hadn't heard of it myself, and no one around me seemed to have heard of it either. So that was the first major problem. And then to find out it was very rare. So actually I found out that at the Royal Free there's a patient foundation which has actually been pivotal in helping me to get through these last 2 years. They've organised the International Neuroendocrine Day today, and I went to the first one last year. And with the support of the team at the Royal Free Hospital and the Patient Foundation, my consultant has actually given me some hope to keep my disease more stable and to keep me alive a little bit longer than I at first thought. So 2 years on, I've actually been able to get through lots of traumas, and they've obviously been trying to understand how my disease is progressing. But I've now been able to experience some radiotherapy to help with some of the bone pains. I've also had 2 lots of radionuclide targeted therapy, which I've just had 1 lot last week actually, so recovering today, and I'm already feeling a little bit better, and this could give me stability for a year or even more. So to me, it's and my family and friends, it's been such a very difficult journey, but one that we've really, really worked hard at, and we feel that we're getting somewhere now.
That's excellent. And if I can just ask you again, if you had to if somebody was in your position before diagnosis, have you probably a tip or recommendation that you would say to somebody in the same position as yourself now?
Yes, I think the thing is you're not alone now. We are, having more contacts and a better network for neuroendocrine cancer. There's more research going. So do look at the Centres of Excellence at the Royal Free, the Royal Marsden, Basingstoke, Southampton. If you just Google it or go to the Patient Foundation for Neuroendocrine Cancer, they would actually help you and put you in touch with some experts that would be able to look at you clinically, and also to help you to meet other patients with neuroendocrine cancer as a support group, because to support one another is really, really important.